months and months and months, that it can live dormant in your body for up to 6 months. Because it took a while. Like I started running really high fevers, like in January, and you know, I tested positive for Lyme's, but I'm always going to because I had that in high school. But then they tested me for Ehrlichia, and that's what I had. And I hadn't had a tick. I know I hadn't in months.
It
and
seems.
they said it's kind of common.
I know, and there's so much conjecture, rumor, this and that, without some really hard research. Like the CDC's research, you know, they've got these doctors that are advocating long-term antibiotics, and the CDC research on the use of antibiotics, the longest time that they used was 24 weeks. When some of these case studies of people I've seen, they're under antibiotic treatment for a couple years. The one documentary I viewed, they did a case study on a woman in Florida, and at her worst, she looked like she had cerebral palsy. I patterned that scenario after her. And she was on 2-3 years, and they showed her, you know, walking around and talking to the doc after 2 to 3 years of antibiotic treatment, no symptoms. She went from being barely able to breathe, with compulsive movements, facial droop, slurred speech, inability to really walk. She went from that to walking into the doctor's office and going, I'm feeling so much better. But it took years of intravenous IV. These aggressive doctors, they'll actually put in a subclavian and they'll inject high-dose antibiotics every day. And that's the big conflict. Mainstream docs go, we don't need this, or it's something else. It's MS, or it's chronic fatigue syndrome, or it's fibromyalgia. And plus the test isn't very reliable, so it's very hard to pick it up sometimes.
You said you used MS because the patient presented kind of like having that. You said she had facial droop?
Yep.
Okay. Can anybody tell me what the facial droop was?
Bell's palsy.
Bell's palsy.
It's second
Yep.
stage.
And Lyme's disease brings it on very well. My stepson lives in Rapid City, South Dakota, and he was sick and continually sick, and then woke up and had Bell's palsy. The doctors would not check him for Lyme's because they don't have Lyme's in South Dakota. He finally went to an old school doc, little practice out in the middle of nowhere, and guess what he had? Treated it, and within 2 days Bell's palsy was gone and he started feeling better. We just recently received a dog back from South Dakota and took the dog in, had him checked right away. Sure enough, he had Lyme's, had him treated right away.
So I think it's much more prevalent. Plus, the mainstream, like the Infectious Disease Society, they'll deny the existence of chronic Lyme's. If you have any symptoms post-treatment, those 4 weeks, they call it like post-Lyme's treatment syndrome. And you know, we all know what syndrome means. Collection of symptoms, they don't really know what it does. You know, syndrome is what they add to something when they don't really know.
I thought that was fibromyalgia.
Well, that again, but here, the symptoms, you get 3 general stages of symptoms, and I just took this off of the CDC website. And I'm a big fan of the CDC website. They have all sorts of fact pages, I suppose. I'm betting a lot of you guys have been on CDC before, because if you want to know anything about bloodborne pathogens or vector-borne pathogens, that's the place to be.
UW actually has a pretty good website about the tick-borne diseases.
Yep, it's a brand new one, yep.
Yeah, I was going to bring up the DHS site, and maybe the DHS site took it from UW's, because they've got a good page on tick-borne diseases.
This is a researcher, her name is Susan,
Yeah, one
I can't think of it right now.
specifically who's done a lot
Yep.
of research.
Yep, and she's got her own website right now, and she's the one that just discovered the Texas tick that's here.
Yeah, the dog tick.
Yeah, there's under the early disseminated stage, which is the second. Bell's palsy is included there, so remember, you know, not everything that's a facial droop is a CVA or a TIA.
The heart palpitations, your last heart palpitations is due to changes in heartbeat. One of my partners from Gold Cross, her husband went in with 3rd-degree heart block and it's from Lyme. So.
Well, apparently these spirochetes can get in just about any body system and attack you neurologically, because these people that are claiming they have chronic Lyme disease, they have numerous neurological symptoms. and they look like people who have neurological disorders.
See, with high dose antibiotics long term, doesn't that interrupt our autoimmune, creating us more susceptible to many other things
There
that
is
we
a
just had on
problem
that
with
last
that.
page?
Yeah, and I think that's why the mainstream physicians are kind of against it.
Is that why dogs are more receptive to the doxycycline versus humans, though? Also, they haven't built up
Maybe
the changes to
could be
widespread
that.
antibiotics.
Although, if you look at widespread antibiotics, the real problem with widespread antibiotics is cleaning solutions and the amount of antibiotics we feed to animals. Because less than 50% of the antibiotics we produce in the United States go to humans for disease treatment. Now dogs, probably because they don't get as much exposure to antibiotics, but other animals, you know, we're injecting tons of antibiotics into cows and chickens and turkeys. So they probably have more of the autoimmune stuff from receiving something like that. But yeah,
Again, being susceptible, we're decreasing our autoimmune effectiveness. I mean, it's gonna bring up a lot of the other symptoms just based on the other
and
stuff we're gonna pick up.
what happened, like with this girl Mandy in Florida, is at 3 months she got worse. And that was generally when she was having more trouble with breathing because her nervous system was so numbed that she wasn't getting full expansion of her chest. You know, she wasn't getting good nerve impulses to her diaphragm and intercostal muscles. So at 3 months she got worse. And then from there she started getting better.
Quick question, when you're doing this research, did you find that the state hasn't been without an epidemiologist for quite a while? Do you think that's kind of hurts the whole, I mean, we have one professor at UW-Madison that, yeah, does a great job, but without anyone to collect the data to help track some of the stuff, do you think that's kind of hurting our endeavor, if you will, to find causes and or cures for this?
Well, to try not to sound too conspiratorial, the theory of the folks who did this documentary is the members of the Infectious Disease Society have some sort of vested interest in keeping the standard as it is. And they trace it back to the early 80s when researchers had the ability to patent organic material. I don't know what's going on, but I think there's a lot of resistance from the Infectious Disease Society to stop this. They're actually going to court, and some of these doctors that are treating, aggressively treating these patients, they're getting their license pulled for like a year.